Welcome to Insider Medicine In-Depth. I'm Dr. Susan Sharma. Taking antidepressants while pregnant may increase the risk of miscarriage, according to research published in the latest issue of the Canadian Medical Association Journal. Here's some information about the use of antidepressants during pregnancy. Untreated depression during pregnancy can be harmful to both mother and fetus. Antidepressants have not been proven to be 100% safe during pregnancy, although the risk of them causing problems appears to be low. The decision to use antidepressants during pregnancy is a decision that needs to be made on an individual basis for each woman with her health care provider. Researchers from the University of Montreal studied over 5,000 women who had experienced a miscarriage. The investigators compared the antidepressant use of each woman who miscarried with that of 10 pregnant women who did not miscarry at or before the same point in their pregnancy. Overall, 5.5% of women who miscarried filled at least one prescription for antidepressants during their pregnancy, compared with only 2.7% in the comparison group of women. The use of one antidepressant during pregnancy was associated with a 68% increased risk for miscarriage, while using 2 or more of these drugs was associated with an increased risk of more than 3 times. Antidepressants most commonly linked with miscarriage were paroxetine, commonly known as Paxil, venlafaxine, known as Effexor, as well as antidepressants belonging to the classes known as selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. We had a chance to speak with Dr. Anik Berard, one of the investigators of this study, who offered some further insight.
If a woman is taking antidepressants, I would strongly urge that she plans her pregnancy and she goes beforehand. If there's a switch and antidepressant that is advisable, she could truly get the appropriate therapy once she becomes pregnant. Appropriate therapy being the right type of antidepressant and also the right dosage. If she does become pregnant and she is taking antidepressants, the pregnancy is not planned, she should really sit down with her physicians and really understand the risks and the benefits for herself, frankly understanding that there's no risk zero, because the risk of spontaneous abortion in the general population is 20%. 1 out of 5 women will spontaneously abort their baby for no reason whatsoever. But if they do take antidepressants, that risk goes to 34%, 1 out of 3. So there's no risk zero.
Today's research suggests that women taking antidepressants who are pregnant or trying to become pregnant should discuss the benefits and risks of taking these medications while pregnant. Never make changes in your medication without first discussing it with your physician. For Insider Medicine In Depth, I'm Dr. Susan Sharma.